I am so delighted today to have a wonderful special guest, as we always have wonderful special guests, but I'm particularly excited about this conversation. Dr. Mel Pohl is with us. Mel is a medical doctor who specializes in pain management and addiction recovery, among many other things. He's the chief medical officer at the Pointe Malibu. We'll have his full bio, of course, in the show notes. Welcome to the Element Q podcast. I'm your host, TJWoodward, and I'm thrilled to have you join us for this empowering journey. Each week, we shine a light on the authors, thought leaders, therapists, coaches, and healers of all types who are making a difference in the LGBTQ plus community. Together, we honor those who came before us, the courageous and resilient trailblazers who stood for our rights and recognition. Their strength laid the foundation we stand on today. Here, we celebrate their legacy by diving into the stories, insights, and tools that inspire gentleness, healing, and transformation. So get ready to be uplifted and empowered. This is the Element Q podcast. Mel, welcome to the show.
Thanks. Really glad to be here. Been looking forward to it.
Yeah, thank you for your yes, and thank you for this conversation. We were in the green room, which basically just means we were, on Zoom before we started. And I asked you the question, what comes up for you in the topic related to a deeper healing within the LGBTQ plus community? And I think where we want to start, and I'd love to hear your perspective, what makes our own journeys of healing perhaps unique or maybe slightly different than other folks? I'd love to hear your point of view on that.
Yeah, I mean, it's a great question. I came up with it, so of course it's a great question.
Fantastic question.
I believe in everything I say. I'd say it's a parallel journey. So it's not unique in that each individual, whether whatever subgroup they're a part of, has their own sort of cluster of challenges and stressors. Being a woman, being of color, and certainly being LGBTQ plus in this culture is particularly significant. But start at the beginning. We are different inside from what we see outside as normal, and we don't get any validation for that. Now, that's a generalization. There are some kids that are very affirmed starting when they begin to explore their sexuality, but I don't think that's the rule. I think for the most part, even today, being lesbian, gay, transgender is a secret. And as you know, in the recovery area, secrets get us drunk. And in fact, when I worked at Pride Institute many moons ago, which is a treatment center for, in those days, we called them lesbians and gay men, and we expanded the definition. But the nature of the hiding, the nature of the prolonged secrets for that formative period when we're adolescents, when normal's doing what for boys, heterosexual boys do, and vice versa. And here we are, not being able to make sense out of it. And I'm a real fan of the polyvagal theory and the science of safety. So when I look at how really all illness, but certainly with chronic pain, with addiction, and the role of trauma, and for us, trauma is, having to hide, not being accepted, not finding our tribe for a while. And I think that, sort of jumping ahead, the healing comes from, in part, identifying and finding validation and support for this is who I am and it's okay. That's the message that every human being needs to thrive. And I think for many of us, we don't get it for a really just way too long. So we end up feeling unsafe in a world that is not safe for us. And how do we create safety is really the clinical challenge in the recovery process and in healing from chronic pain. But sort of long way around to say we have our own version of trauma, and it is being different than unacceptable, and what that results in a sense of shame about identity. It's transformative in a negative way,
Yeah, absolutely. And I really love that you're starting with that because I think that's such a common experience for so many humans, but people who are in this community, LGBTQ plus, and like you said, times are changing. And yet, most people, I agree with you completely that it's still the exception where a person feels completely seen and validated. And I know those of us who are of a certain age, certainly it was secrecy, silence, and judgment right out of the gate, right? And I'm using those three words because Brene Brown says those are the three things that cause shame to thrive in the petri dish. And so when I think about being, a person in this community, automatically, like you said, there is a sense of unsafety. And of course, in my model of conscious recovery, I identify the first most important step of recovery as creating safety. And so safety can be an external experience and it can also be an internal experience. But when we come into the world and we get messages, whether they're subtle or sometimes very like either overt or covert messages that somehow not only what I'm doing is wrong in the eyes of some people, but who I am. And that's where that shame core gets developed. And of course, we know then how we heal shame would be the opposite of secrecy, silence, and judgment. And you and I, working in the addiction treatment field and the behavioral health field for as many years as we have, we understand that healing is both an individual and a community or a collective process. I'm just curious for you if we can move a little bit into your own journey, because I know in my experience, the reason I came into behavioral health was my own trauma, was my own recovery, and my desire to help other people heal at a deeper level. And when I started in the field, there wasn't as much focus on trauma. There wasn't as much focus on shame. It was just kind of like, let's get you sober, let's get you stable, and then send you out into the world, and hopefully you'll find some community.
And we'll talk to you about your trauma a year from now when you're stable in your recovery. I mean,
That's right.
crazy.
And what out of your I'll ask two questions, you can take it wherever you want. What out of your own journey led you to this work? And then what do you see right now as the shifting within our field that is changing that paradigm exactly as you just said? Don't worry about anything right now. Worry about that down the road. And we see how that might work for some people, but not for most, certainly not people in our community.
Yeah, I mean, I was so there's a lot to unpack there, but
Yes.
I was a gay boy since as long ago as I can remember. I was attracted to males, and it was always in a box, tied up and buried
Mm.
in my conceptualization of how I was going to live my life. Now, that doesn't mean I didn't act out on sexual experiences, but it was all hidden. And I remember I went to school at the University of Michigan College, and I went to a tea group. Remember tea group? You probably are too young for tea groups, but tea group was this transactional kind of, it was bare your soul. It was a weekend. It was
Mm.
pounding pillows and, just this whole experiential thing. And I was my authentic self, and I met this guy and had an encounter with him. I don't think he was a psychologist, and he said, "What'd they say when you said you were gay?" I said, "I could never say that." It was so far from possible that I would have that as part of my integrated identity. And it took a decade for me to really thaw that out. And in the meantime, I found alcohol and drugs, and they treated
Yeah.
the untreated trauma, the extensive shame. And again, this is not consciously aware, but I think as a community, because of our collective shame and individual shame, we turn to substances, especially if we're vulnerable with a brain that's, predisposed genetically or epigenetically. And then we get into the spiral of addiction. And once you're there, it's, that's a whole journey to get to extract from. And what typically happens in my clinical experience is that as gay or lesbian or bisexual or trans people extract their recovery, their sobriety, then they got to deal with who am I and how do I fit, and what's everybody think about me, and I learned early on in my personal work. So I mean, the quick summary is I went to work as a medical director of a treatment center
Hmm.
in 1982, and my sobriety date's October 13th, 1984.
I love it. Yeah.
I was doing lectures on cocaine, very
There's
stimulating.
something brilliant about that, Mel, somehow.
It's poetic in retrospect, but it was
Yes.
not, it was, talk about the double life of, here I am gay. And by that time, so for me, the transition in terms of being a gay man was when I met a partner who I fell in love with.
Mm.
And the ability to be affirmed in a loving relationship was transformative. I don't know what would have happened if I hadn't, because until I met him, I was going to have a wife and kids and have sex on the side. That was how I conceptualized. And when I found him, when I met him, I was in it too deep to be able to continue to live that way. So then I had to confront how do I live a life as a gay man? And it was tough. It was really tough, and it was tough getting sober. I remember going to my AA home group was a group of straight macho men stag. That was the noon meeting in Vegas where I was living, and coming out in that meeting, which I did eventually, but it was very hard work. Interpersonally, very hard work. It's really scary, really threatening. And it was the beginning of finding my own. And, you said we create our own safety because that world, I mean, the irony is that world, when I came out in that meeting, most everybody said, who cares? I got real problems. I got things I got to deal with. But for me, it enabled me to ground with people and for them to know the real me, if you will. And I think, in terms of healing, in terms of recovery, that's the ideal, the optimal route of finding safety and health, growth, restoration in a polyvagal sense. Finding and all that happens incidentally from a polyvagal lens through kinds of things we're doing, co-regulation, seeing each other's faces and knowing that in this session, even though, God knows how many people are listening, we're having conversation and it feels safe.
That's right. And I love that you're saying all of that. And we have such similar journeys. I didn't quite realize that. I got sober in 1986. I think one difference is I didn't start in this field until much later, 20 years later, in 2008. But I really appreciate really everything that you're saying. And as you're talking, I'm going back to what you were talking about originally or earlier, which was this sense of a normal adolescence, this sense of experimentation, this sense of being seen. And I think for LGBTQ folks, we bury so much of ourselves. And I remember the first time I was with my friend, we were just like walking in a mall and he changed the pronouns of the person he was dating to she because he was afraid someone would overhear it. And I remember just thinking I was simultaneously shocked, but also just felt a lot of sadness that he was afraid to even say he as the person he was dating, right? And so many layers of shame. And for those of us, grew up at different times. I mean, I grew up in Indiana. Uh, the 1970s in Indiana were definitely not necessarily, and I'll say necessarily because there were individuals who I felt safe around, but for the most part, it really wasn't safe to be this little effervescent, very enthusiastic, and very effeminate little boy, right? And so much got buried, and of course, as you said, and I always want to lean into the actual brilliance of drugs and alcohol, or whatever we find to manage or assuage this sense of brokenness. And I love that you said it wasn't conscious. Like I wasn't walking around saying, I have so much shame, partially because I'm a gay man and I feel so disconnected from myself and I have all this trauma. I'm going to find something to use to escape. No, someone handed me drugs. I took them and I was like, hallelujah, I feel free again.
Yeah.
And so the journey of recovery, and I think I'd like to just ask you, not only in your own journey, but How do we? Because in my experience, it did start with safe places. It did start, and in my experience, it was women who really helped me in the beginning of my recovery because they were the only safety for me. I remember accidentally walking into, as you described your men's stag meeting, I remember accidentally walking into one and my whole body started shaking because of my unresolved sexual trauma, because, of my being called the F word almost every day in Indiana in high school. At 18 months sober, I found myself suicidal. And that's when I started doing some of the deeper work because I was almost forced to if I wanted to stay alive. So, how do we actually help people start to heal? And I know you've already talked about some of it, but how do we help someone do the deeper healing and actually turn toward healing this trauma and shame we've been talking about?
I think that the beginning of healing is finding safety. And I was just listening to a woman named Deb Dana just before this. She's doing an hour-long discussion of polyvagal theory. And what she talked is, there's the ventral vagus, which is the healing, co-regulating, communicating, safe human place that we create safety for ourselves, and that we can get glimmers. She calls them glimmers, sort of real moments of safety in relationship and in circumstance. And I think that having, I don't think we can rely on our patients or our clients to create their own sense of safety. I think they're too ill with the disease of addiction and with unresolved trauma. So I think somehow or other, I mean, at the point we create a safe, I mean, the purpose of our treatment program is that people walk in and feel safe. So it's, from the start to the finish, every staff is trained in safety, and it's not just customer service. It's, really being aware that when we sit together, the state of my nervous system impacts the state of your nervous system. So I better be monitoring my own nervous system and be in a state of ability to co-regulate before I meet you. And when I meet you, whether it's LGBTQ or somebody who was raped or somebody who is racially attacked, or, there's so much, oh gosh, I mean, you've heard it, I'm sure, the stories that come across from people's lives and how they've come to this moment are tragic and ghastly and overwhelming. And those people do recover, if afforded an opportunity to ground in safety. Now, I'm also a firm believer in the disease concept of addiction, or that addiction is a disease, and no matter what else, you got to give up the chemical to let the brain thaw out so that it can begin to heal. So, going back to that question about when do you deal with trauma, what happened to me was when the anesthetic effect of alcohol, and for me, marijuana was my drug of choice, and all the other, sundry chemicals that I put in my body, when that was eliminated, I was in trouble. People say, I felt at home in AA. I felt like an outlier. I felt, it was like my secret was continued. The alcohol part was being dealt with, but the shame and the identity part was not. And that was a process to find. And, for me, I was able to create safety, but also find it therapy and with really in relationship with a partner who was unconditionally loving, a man who loved me, warts and all, he used to say. He has seen all of it, and yet he loves me. So that was a very powerful experience. Not to suggest that people need to find a lover to be able to get sober, but it was, for me, it was crucial to have a key person, and I think a therapist, or a therapeutic environment, or a sponsor, somebody in that recovery mode that can join the process and enable me to do my work so that I can feel safer and safer, because you have to feel safe to heal.
Yeah, and I love a couple of, I mean, everything you're saying is so true to me as well. And this idea of co-regulation, if someone is watching or listening who doesn't understand what that means, it's so simple in so many ways. As clinicians, we get to be a presence for someone. And really, what changed my life is a woman came into my life. I've dedicated my life's work to her. I always talk about her because she saved my life, not through what she said or taught, but how she was being and seeing me. And that involved her doing enough of her own healing. And I think that's where I'd like to like kind of move the conversation because we are in the midst of a paradigm shift in our field. I started in 2008, which isn't in the scheme of things that long ago, but back then we were still like treat the symptoms, stabilize the client, get them the care they need after treatment. Now we're realizing that our clients are coming with multiple layers of different issues. There is not a one size fits all approach, right? There's not even a one size fits all approach to how we address trauma and shame, but we know that at the core of it, or the most important first step, as you've so brilliantly pointed out, is this sense of co-regulation. And all that means is, and I'll say it in my language, is that, and because this is really truly my passion to help clinicians be able to do this more effectively, that is, if my nervous system is on guard, if you will, or I'll put it this way, if I haven't done enough of my own healing, I might have the hero cape on, or I might be wanting to fix a broken person. And what we're talking about, true safety, is something really different. And that is, I can slow my own nervous system down enough. In my language, I would say I'm grounded enough in my essence that I can be a presence for someone, because true healing, paradoxically, the person does their own healing, but they are, as you said, not at a point in their life where they're able to do it alone. So what's our role? I think the first step, as you've said, is to help someone create enough safety where they can slow down enough to be able to access something happening within. And in some ways, that's very different than the way some people are taught. Some people are taught, like, I'm going to do a clinical intervention, I'm going to give you a toolkit. We do psychoeducational groups where we're teaching our clients things. But in the end, to me, the most important thing is that deep human connection. I like to use this quote from Dolly Parton. It takes a lot of money to look this cheap. I love that quote from her. It takes a lot of my own work on my own journey to look like, or to be not doing so much, but really being present with someone.
Yeah, it's well said. When I teach clinicians, and if there are clinicians on this call, I mean the real importance of being present. I mean, I treat people with the trifecta, we call it: trauma, addiction, and chronic pain. So people who've sometimes medicated their pain to survive, always preceded by trauma. Trauma predisposes to chronic pain. So the connections are all integral. And the most important thing I do, I'm a physician. I've got 45 years of experience in addiction, 20 years in pain specifically. The most important thing I do is I walk into the room and I pay attention and I listen and I allow the person to really tell his or her story. And without, I tend to clarify, interrupt, but mostly, and that's not my way. I mean, I have been trained in a number of different clinical methodologies, including motivational interviewing. So listen more than you speak. And when I'm listening, really paying attention, and there have been times where I've said very little and the person is crying through the story and their pain is so awful, it's 12 out of 10 and they can't live life and there's no hope. And at the very end, they say, "Thank you, doctor. You helped me so much today." It's like, what the, but it's true. So, and really now it's 3 years ago I discovered polyvagal theory. And what I've learned is that if we are on guard, if there's an if I'm on alert, if I'm getting danger signals, it activates my sympathetic nervous system and pain goes up. There's more pain when I'm anxious. It seems logical, but it's not always well accepted by patients. And, when I explain this, and we do some amount of psychoeducation because you got to know the information, and then you have to prove it to yourself. So step 2 in our pain reprocessing therapy is really seeing that my emotions drive my experience of chronic pain. And I get a lot of pushback. People are like, no, no, it's my shoulder, or my disc disease. And one patient said, "You telling me my pain is in my head?" I
Right.
said, "You have headaches. Like, where else do you think your pain is?" But the implication of it's in my head is I'm crazy and I need to see a psychiatrist. And that's not the fact is it's real and emotions and thoughts are driving it. And we need to pay attention to those. And then we need to enable you to work with those. And then the most recent thing that I've learned in the last few years from my colleague, Dr. Les Ari, a psychologist, is that more healing happens from the bottom up than from the top down. So I can talk, and I'm a talker. It's my still my main modality, but really being with your breath and being with your body and the neuroceptive system that is tracking what's happening, that's where safety is created. So your nervous system picks up when I'm smiling and when I'm relaxed and the tone of my voice is even and modulated and we respond to each other. That's co-regulation at its best.
That's right. And in my work too, I lean into the energetic conversation as well, because everything you just said is so true and motivational interviewing is so effective. And when we're talking about co-regulation, really the way we primarily interact with one another is energy. And many of us have forgotten that. And that's why equine therapy, working with horses, is so powerful, because you get to see that that horse in front of you is feeling your energy. I got dragged on social media. I know that's shocking, but I said in a talk, one thing I know about clients in early recovery is they're highly attuned. And then the editor clipped it right there. And this person said, "I've been working in the field for 35 years. How dare you say they're highly attuned? That's asking too much of them. They're in the midst of their trauma." What I was speaking about is what you're talking about, and that is any of us who have trauma, which is every human to some degree, right? But our clients who come to us, maybe more so, and they're at a different point of being able to work with. We're that's one of the things we're doing, is we're not trying to remove someone's trauma, but help them learn how to live with it in a new way. They're highly attuned to who's safe, and I love that that safety conversation keeps coming back because it is so vital. Mel, you might not believe this, but we're actually toward the end of the conversation. We just have a few minutes. I feel like you and I could talk for hours, which I'm bookmarking that. But I'm wondering if there's anything in closing that maybe we haven't discussed or that you want to talk about. Certainly let people know how they can contact you. Of course, we'll have all that in the show notes as well.
I think, going back to the initial conversation about LGBTQ people, find safety. So if you're a person who identifies as part of that group, find safety for the whole package. If substances are involved, I think the message is you have to have a break from the substances so your brain can heal, and then you got work to do. And, so as I say to most of my patients, buckle up. I mean, I got a sponsee who he's facing something newly traumatic. He's 2 years sober, and he's like, "You said buckle up, but I didn't think you really meant it." Life comes, and this is not necessarily a safe world that we're in these days. So, however you can, whether it's just identifying a human being or some sort of a group process, find your way to a place where you can ground and feel like there's hope. So it's not an expectation of I'm going to be great, but simply there's a possibility that I'm going to really be able to have a better life. And I can absolutely guarantee you can have a better life.
That is true. Through our experience, our own experience, and witnessing our clients heal in these beautiful and miraculous ways. Dr. Mel Pohl, I so appreciate you and your decades of work you've done in this field. I just always love being with you, and I feel more energized when I'm with you in conversation. And that, I think, is the greatest compliment, because I'm feeling so many ideas pop up and percolate. So thank you very much for the amazing work you do. And for everyone who is watching or listening right now, if this conversation is something that has resonated with you, of course, please like, like and subscribe and share it with someone who might want or need this information. Mel, thank you so much once again for being a guest on the show. Peace and blessings, everyone. Thank you for joining us for this episode of the Element Q podcast. It's an honor to walk this path of healing and transformation with you. Remember, the courage and resilience of those who came before us live on in each of us. Let's continue to carry their legacy forward as we support one another in creating a world filled with love, gentleness, and empowerment. If you enjoyed today's conversation, please subscribe, leave a review, and share this podcast with someone who needs to hear it. Together, we're building a brighter future, one story at a time. Until next time, I'm TJ Woodward, and this has been the Element Q podcast.